What if a leading research institute started not with a massive federal grant, but as a small lab solving a problem no one else would touch? For 30 years, Bedford Research Foundation has pursued underfunded science without federal support, advancing stem cell research, reproductive health, and research on infectious diseases. But it all started 30 years ago with one urgent question. Can HIV-affected couples safely conceive healthy babies?
The American family is now threatened by the AIDS epidemic, even by the most casual contact.
At the height of the AIDS crisis in the 1980s and 90s, the disease was killing tens of thousands of Americans every year, and terror often outweighed evidence.
It's in saliva, it's in tears, it's in perspiration.
Even after patient advocacy led to the development of effective medications, the drugs didn't work for everyone, and dread and stigma persisted.
Everybody was so terrified of HIV, and I knew I wasn't because I'd worked with this family of viruses for many years.
The Bedford Research Foundation was formed when a small group of patients, doctors, and scientists came together with the goal of letting data, not fear, guide what was possible, and to answer an urgent question: could men living with HIV safely father children? As new medications helped stabilize the health of HIV-infected patients, they began to return to normal life, and with that, their dream of having families.
I didn't know that I was breaking new ground. All I knew is I wanted to have a baby. I was just trying to have a child. I was just trying to be a mom.
The first patients to advocate for the program were women whose husbands had been infected with HIV through a clotting factor for hemophilia. Adoption centers would not consider them, and their doctors told them that their only options were to risk getting infected or give up on having children altogether.
Knowing what I probably would have done to have had children made it really clear to me people are not just going to go home and not have kids. It was a women's health issue.
My sense of it is that the couples were going to try anyway to have children. I felt if we could do anything to reduce the risk of HIV transmission to the spouse or to the child, that was the more important moral imperative.
From that belief came SPAR, the Special Program of Assisted Reproduction. Not a large institution, not a government project, a small research collaboration focused on developing a safe, evidence-based fertility method. The scientists and doctors developed a fertility method that allowed these couples to use IVF without transmitting the HIV virus. Soon, SPAR was also working with male same-sex couples who wanted to conceive safely through surrogacy.
There was a real stigma associated with either being gay or having HIV.
It didn't matter how they got infected or who they chose to love.
I'm hugely gratified by what we were able to do for these families. There are hundreds of families now that have been created because of this program.
In 2026, SPAR celebrates 30 years with more than 500 babies born and no transmission of disease. Proof that transformative science can thrive outside traditional systems. In addition, the program has led to scientific innovations that have helped thousands more couples conceive safely. It also became a model for how the Bedford Research Foundation continues to operate today.
Because of our financial independence, when Congress restricted funds for embryonic stem cell research, it left us in a unique position. We were one of the few labs that could keep the work moving forward.
The foundation remains financially independent, supported by donations and private grants. The work now addresses critical, underfunded questions, from stem cell studies using human eggs to continued research on HIV and viruses like CMV that affect reproductive health. Each project is reviewed by an independent ethics advisory board, ensuring that innovation never outpaces integrity. And because all findings are published in peer-reviewed journals, the data remains open to the public, so future discoveries can build on what BRF scientists have learned. With your help, we can continue to ask the questions that change what's possible. Join us. Support 30 years of courage and the next 30 years of discovery.